bottom right-hand corner where you can start chatting to everybody. So please do say hello in the chat box. Welcome, Jill. So Jill's from Cheshire and Mersey. We've got Sandy from the Transformation Lead. Fantastic. Welcome. Hello, Sue. We've got Sue joining from NHSE.
Zoe, it's really nice here that we've got colleagues from Wales and Scotland with us as well, which is fantastic.
Thanks, Helen. So we're just saying hello to everybody in the chat box. So just as people are joining, please just say hello in the chat box. And then in a moment, we're going to have a little look about where you are in the country. So hi and welcome, Nikki, team manager in NHS BT, managing organ donation team. So well done and thank you for joining us. Paul, I think we should go to a little annotation. Could you tell us how we could annotate this slide for us, please, Paul?
Thank you, Zoe. I've just taken the presenter's ball back so I can give everyone the controls. What you'll see appearing in the top left of your screen are the annotation tools. So if you'd like to make a map, as Helen's just demonstrated, if you use the arrow and then click on the map so we know where you are. If anyone can't use the arrows for any reasons, then please feel free to use the chat. And as Helen's pointed out, for those people who are joining from either Scotland or Wales or anywhere that isn't marked on the map, please feel free to use the chat or get creative with a pen and draw your location.
Thank you, everybody from Wales and Scotland joining us as well. Please continue to draw yourselves on the map there. And welcome. So we've got some people in the northwest. We've got a lovely group of people there in the Midlands as well. And I think the southerly point so far is Neil. And we've got Jordan so far, who is the most northerly person. Teesside, hello, welcome. And we've got Jess there, sort of halfway between the Midlands and the north of the country there.
We've got a couple of people in the chat as well. We've got Jordan, who's up in Dundee, Scotland. We've got Dr. Dimitri, who's a specialist, who's in Oxford. Claire Marshall, who's in Ashton-under-Lyme, and Paula from sunny South Yorkshire.
Thanks, Paul. So please do keep commenting in the chat where you're from and maybe marking on this lovely map here about where you are. And Paul, could you just give us some instructions again how to do that?
Of course. If you look in the top left of your screen, you should see a bar which has got some icons on. The very left icon is an arrow. If you click on the arrow and then click on the screen, you should be able to put an indicator of where on the map you are. If anyone doesn't have access to those tools, then you can use the chat. You can find the chat by clicking on the chat bubble in the top right of the screen, and that will then let you post your message and let where you are through the chat. And it's less testing geographically for us as well
Excellent. Welcome, everybody. We've got so many people joining us live on YouTube and throughout the webinar as well. So fantastic. Thank you so much for joining us on our first Wellbeing webinar. So keep those arrows coming in. And then just in a moment, I'm going to ask my colleague Paul to capture the screen, close the annotation, and we'll be ready to start our first Wellbeing webinar.
And thank you. As the map's getting quite busy now, we're getting a very decent spread. And we've got Northern Ireland introduced to the map now as well. So I think for the next week, we'll make sure we've got a more representative map available. So you don't have to be quite as creative with your annotation. But it's great to see that everyone's there. There's those people who are unable to use the arrow or continuing to post in the chat. So thank you for that. That will be available throughout the session for any comments or questions you may have.
Yeah, the furthest, hi, it's Helen Bevan here. The furthest away from the chat box is the Netherlands. So if you're further away than the Netherlands, can you let us know? So let's get a sense of our geographical spread.
Thanks, Paul, and thanks, Helen. Could we close the annotation, please? And we're going to get going with our very first Wellbeing webinar.
And for Ollie's benefit with the YouTube link, do you want to just give him a 4-second countdown, Zoe, so he knows when to start the recording or start the stream?
Yes, sure. From now. So, welcome everybody. This is our very, very first Wellbeing Response webinar. And hello, my name is Zoe Lord. I'm part of the Horizons team and part of the national response to the wellbeing and how we look after ourselves and our staff and our colleagues and our friends throughout this period. So this is our very first session on Wednesday, the 8th of April, and we'll be running these sessions every Wednesday so that we can learn together and support each other throughout this time. This is our team today. So hello, I'm Zoe, and I will be the facilitator and take you through this 1-hour session. We've got some fantastic contributions coming from Dr. Sonia Wallbank, Professor Michael West, Professor Neil Greenberg, and Dr. Helen Bevan. We've got a massive team behind the scenes as well. So we've got some technical hosts. So if you're having any problems, just mention it in the chat room. And we've got Paul, Selena, and Zara who will help you out during this time. We've got some chat box facilitators. So what I'm going to do is invite you, if you are on the webinar, then please do add to the chat box. And you'll find that by moving your mouse to the top right-hand corner, there's a chat button, and then down at the bottom of your screen, a chat box will open. I'd welcome everybody to use that chat box, ask lots and lots of questions to our contributors today. So we've got Louise and Karen who will be helping managing the chat and ensuring that your questions are asked during the session. And we've got my colleague Lee Kendall, who will be on social media. So we'll be tweeting a lot today, and we'll be using the hashtag caring for NHS people, and that's the number 4, caring for NHS people. So if you'd like to follow the conversation, add to the conversation, share your experiences and what you're doing as well with others, then please do use that hashtag. So the aims of this session. Now, what we want to do is really work together on this. So we want to offer support, ideas, knowledge and wisdom to those in a role who are supporting our colleagues with their health and wellbeing. We want to share a range of wellbeing support activities that are available to people working in health and care. And we know that at this really, really busy time, lots and lots of information is popping up from everywhere. And we've got Professor Neil Greenberg, who's going to be sharing with us some do's and don'ts of how to support staff during this critical time. So how's this all going to work? Well, I'm going to help us through this. Then we've got Dr. Sonia Wellbeing, who is leading the clinic. She's the clinical lead for the Wellbeing programme. And she's going to tell us all about the national support offer that has been launched today. We've got Neil, who's going to be talking about the do's and don'ts for supporting frontline staff. And then we've got a wonderful conversation that's going to be with Sonia, Neil, Michael and Helen. And we're going to be answering your questions. So if you've got questions, then please do ask them in the chat box. And then we'll get our experts to answer as many questions as possible. And then we're going to finish with a call to action about how we can support one another, how we can have two-way conversations so that we can support each other through this difficult time. I'm going to start with two polls before I hand over to Sonia to provide us with a national update. So, Paul, I was wondering in a moment, please could you open the poll? And what I'd love us to answer within the poll is, to what extent is your organisation geared up and ready to support the health and well-being of your staff during COVID-19? Now, we've got a scale here. So we're not ready, all the way up to we are ready, and we have a comprehensive package of support and leadership systems in place. So, Paul, please could you open the poll for us?
Thank you, Zoe. I've now opened the poll. So for those of you on the WebEx, you should be seeing the poll appear on the right-hand side of the screen. For anyone who can't answer the poll because they're either unable to click the controls or are viewing through YouTube, then please use the respective chat channels so that your answers can still be included. The poll will run for about another 5 seconds, and I'll share the results on screen as soon as they become available, which would be about another 15 seconds. Just wait while the system compiles the results. That will be up on screen in just a couple of seconds.
Thanks, Paul.
And they should be visible to you and everyone else now, Zoe.
Lovely. Thanks ever so much, Paul. So what I can see here is there's probably, let's see if I can just open my poll a little bit more. There's quite a lot of people. The majority are about number 4. So they've got quite a lot of systems in place, which is absolutely fantastic. So the majority of people are in that sort of that 3 to 4 window. And we've got some people who are saying, number 5, we are ready. And just 2 people out of the 218 people who have answered said that they're not ready. So thank you ever so much for that. And it's fantastic to know that there are so many systems in place across the country. We've got one more poll for us before we launch into the national offer. So, Paul, could we launch this one, please? So this question is all about how clear are you about your own role and responsibilities in supporting the health and well-being of staff during COVID-19? So we've got number 1, which is I'm not clear, all the way up to number 5, which is I'm really clear. You're part of an approach, an agreed approach and support system, and have the skills and backup to do the role.
Okay, thank you, Zoe. The poll's now open, and the same applies as last time. You should see it at the bottom right of the screen. For everybody else, if you'd like to put your answers into the chat, and just to clarify, we will be saving the chat, so anything we don't directly refer to during the course of the session, we will pick up on afterwards. The poll runs for about another 10 seconds, and then it will take about another 15 to share the results, Zoe, and then everything will be available for you and everybody else. And it was just coincidental that the cockful decided to shout out just as the poll was closing. About 5 seconds and the results will be on screen for everybody.
Thanks, Paul.
There you go.
Fantastic. Thanks ever so much. So you'll all be able to see on your screen that the majority of people are sort of at point number 4, which is clear. We've got 111 people that are saying that they're clear about their role. We've got about 74 people out of the 288 who answered that time are in the middle. And we've got 68 people who are actually saying, actually, I'm very keen, clear, and I have the roles and the skills and the backup to do the job. Fantastic. Thanks ever so much, Paul. Could we close those?
The poll's closed, so if you just click into the chat and move on the slides.
Sorry, Paul, I'm just having a moment that it's asking me to save the poll. Excellent. We're now in work order. Thank you ever so much, Paul. So I'm now to introduce you to Dr. Sonia Wellbeing. She's the clinical leader for the health. And I'd just like to say her leadership over the last 3 weeks. She's galvanised global experts, people across the world, to get their knowledge, their expertise, know about the evidence, how to make a fantastic national wellbeing offer to our healthcare staff. So I'll introduce you to Sonia, and please tell us about this wonderful national wellbeing offer. And tell us about the offer.
The unmute button is just next to your camera button, Sonia. So to the right of your name.
Hurrah! Thank you. You threw me up there with that lovely ending. Not at all used to working at this sort of pace and scale, and they've really stepped up for us. So a huge thanks to everybody that's been involved. So what I wanted to do was just take you briefly through how we've come to the decision of what frame we're actually working in. We wanted to make sure that the offer that we have is a personal one. We recognise that staff at this time will need to access help that fits their individual needs, and this will be different for each person. The frame of reference that I'm offering you here is a guide and will help us prioritise the work that we're involved in and also understand what we think is coming next. So what we've done is talk to many experts who have dealt with things like the response to the Manchester bomb, the London bomb, the King's Cross fires, as well as those experts who've been involved in longer term psychological responses. So Gulf War syndrome, the Ebola epidemic recently, and 9/11. So this has given us a really broad view about what will people need immediately, what are the things that we should be thinking about now, what happens as the intensity of the work picks up. You know, you've probably heard a lot of people talking about the peak and the peak that's coming. And then what happens after? There's no point in just thinking about, you know, while we're in the eye of the storm, what will people need beyond that? And so I have pulled together a framework around preparing people, making sure that people are aware of what's to come, that those basic needs are being met. So as part of our health and wellbeing offer, we're absolutely focused on transport, childcare, accommodation issues, making sure that what's happening in our local settings means that staff are getting the right support when they need it. We know that through the active phase, so some people are already here, you know, colleagues from London will recognise this, utterly intense and consuming periods of work. You're not able necessarily to think about your own health and well-being, and how can we help you, prompt you to be thinking more about yourself so that you can sustain your ability to come back and forth to work in the long term. And then recovery, thinking about those of us who have been involved in difficult decision making, probably not ready for the work that's been thrown at us. Everybody's stepping up and beyond for the work that they're currently doing. And then just thinking about how we might process some of the experiences that we've been through. And have the next slide, please. Zoe, thank you. So we'll share the slides afterwards so you can have a look at this. But what this has done, these 3 phases, is really guide what we think needs to happen and where services need to be available to intervene through those 3 stages. Happy to go to the next one, Zoe, thank you. So what we've launched today is a website that you can access just by scanning the QR code. It's people.nhs.uk for those of you that haven't got the phone scanner today. And that's available for everybody, those resources. So what we know is that resilience lies in teams. So we are very much focusing on how do we help you manage and lead through the crisis? What things do we need to be doing differently? And we've involved a range of people to help us build those materials, not least of which Sandhurst Academy, who have been great at giving us some short and snappy tools. And you'll hear from Neil and from Michael West today to share some of the work that they've been doing with us as part of this task force. We've then got the helpline that's set up from 7 a.m. to 11 p.m, as well as a text line that you can access that's actually a text conversation with a person, but anonymous. Silver Cloud have been amazing. They've released all of their wellbeing apps, modules for anybody working with the NHS and their families, just by clicking on that link or scanning the link and entering the code. And then I'm sure you've already heard about the mental health apps that have also released applications for free. Thanks, Zoe. So what we wanted to do was make it really easy for staff. We're very much seeing our national offer as building on the fantastic work that local providers are doing, so not instead of complementing. We also know that we are not very good, I think, as a group of professionals at seeking help. We help other people. We don't do it the other way around. So we wanted to give you as many opportunities for a comfortable way of seeking the support that you need. So our front door is very much our helpline, which Samaritans are supporting us with, and Shout, the charity, are helping us with the text support line. All of the way up then through the different doors where we've got offers, again detailed on the website. Hospice UK have come together to partner with us with 200 of the hospices around the UK to offer specialist end of care and bereavement support for staff. We've got the line manager and team kind of upskilling with some really great hints and tips about what to do at the end of shift. And we're currently developing a concept that we're calling common rooms, where you can drop in, be hosted by somebody with some psychological background and support, and know that that's a safe space to have a conversation with people who are maybe going through similar stuff to you. Thanks, Zoe. That's great. And again, this is just the full detail of what we are intending to offer. So I won't bore you with the details on the webinar today, but absolutely there, so you can see what's coming. And at pace, so by the middle of May, we'll have the whole offer up and running. Thanks, Zoe. And there you go. There's a feedback link there. So more than happy for you to get in touch and tell us what you think. We're very much seeing this as an iterative offer. We won't have it all right on day one. And what we want to make sure is that we're listening to you and that the national offer is responding to places that you see that there are a gap. And so please do get in touch. Thanks, Sonia. So if anybody has any questions, either on YouTube Live or if you have any questions in the webinar, then please don't hesitate to put them in the chat box and we will pick them up as we go along.
So next, I'd like to introduce you to Professor Neil Greenberg, who's going to talk about the do's and don'ts of supporting frontline staff. And as Sonia said in her introduction as well, this has been a real team effort, and Neil has been a wonderful partner to the NHS. So over to you, Neil.
Hello, thanks very much indeed for allowing me to speak for a little bit on this really important first webinar. Can I have my next slide, please? So I've only got one slide, you'll be pleased to know, so that's everything I'm going to say. So the first thing to really try and emphasize is all the support mechanisms and processes that Sonia's talked about, which are great, are no substitute for having a good team. We know that from looking at all the evidence about military personnel, about media professionals, diplomats, and a whole range of other people who work in challenging places, that consistently the best way to protect your mental health is to have really good supportive relationships with the people who are closest to you at work. So that may well be your colleagues, and really importantly, it's your supervisor. And so what we really think needs to happen, and indeed I think from my experience is happening lots anyway, is for supervisors to have what we're going to call a psychologically savvy chat. And that basically means that they feel confident enough, not just to say, how you doing? And then when someone says, I'm feeling fine, they say, that's great, because we all know that fine doesn't always mean you are fine. But a psychologically savvy conversation is one in which you overcome that reluctance to speak about your mental health, and the supervisor is able to draw out information about how you really are. What are you worried about? Why were you a bit emotional? What are you thinking about doing later? Are you going to come back to work tomorrow? And we know that our scientific evidence studies that we've done over the years have shown that actually, if you look at people who are in really, really tough positions, having a supervisor who is able to really understand what you're going through and offer reassurance and advice makes a huge, huge difference. And everything else that we might put in place probably is not as important as making sure that team works. It's a rather cheesy way of putting it, but we know that actually resilience often doesn't lie in individuals, it lies between individuals. So make those social bonds between the teams really strong, and actually that will pay really important dividends for how people will manage to cope with adversity over time. We also need to make sure that we don't let people who have difficulties begin to deteriorate over time, and then by the time they ask for help, they're in a real crisis. So therefore, we also need to make sure that NHS organisations are adopting a nip it in the bud approach. So one of the important principles here is that if you see someone who's not doing well, then you shouldn't just think, oh, well, that's their business, not mine. At this time in particular, given the stresses and strains that we're under, it's really important to have one of those psychologically savvy conversations. However, it's also important for all of us to be aware that if you're doing really challenging work and people may be dying and the shifts may be long and it may be quite emotional, that actually feeling some level of distress is completely normal. It's not an indication that you're having the onset of serious mental health problems. It doesn't mean you can't do your job. It doesn't mean that there's something wrong with you. Of course, the important bit here is we want to be looking out for normal distress and listening to it. But at the same time, we want organisations to be trying to spot abnormal distress and to, in that case, make sure we get people the right sort of help. So what is abnormal distress? Well, simply put, the two key factors about it is it's very, very intense and impairs how you are able to get on with your life. So it impairs your job, it impairs your social life, it overtakes your life and your thoughts even when you're trying to sleep. And the other thing about it is it's persistent. So intense distress for a short period of time, quite normal. Not such intense distress going on for a long time whilst the crisis is going on, not necessarily abnormal. But intense and persistent, those are the indicators that really you want to be helping that person to get to professional care. Now, in the military, we've learnt lessons over more than 100 years now, that actually there are 4 general principles that make a big difference in managing staff in really challenging situations. The first principle is the principle of proximity. And what that means is that when someone's having a tough time, you shouldn't just send them away or send them home. Instead, you should keep them within the team and try and redeploy them or change their role a little bit to reduce their stress in the short term. We know that the evidence is that keeping people within the team helps them feel that they're being useful. And also, if you send people away, then what happens over time is they begin to wonder that everyone else is thinking badly about them, even if that's not the case. The second principle is the principle of immediacy, which is very much going back to that nip it in the bud approach. If people are having difficulties, make sure that you get in there and have a proper psychologically savvy conversation in order to really find out how they're doing, and that will allow you to plan how to help them. The third principle is the principle of expectancy. So the expectation in the current world that we live in, particularly if you're a healthcare and member of staff, is that things are going to be a bit tough for a while. And that doesn't mean you're ill. It doesn't mean you've got a problem necessarily. And the expectation is also that things will get better. And we know from all the guidance and the information we've heard from government, from Public Health England, from the NHS and scientists, that however difficult this crisis is, an end is to be expected. And the last principle is the principle of simplicity. And simplicity principle says that if you're in a real crisis and you're having a difficult time and you're very emotional, often simple things like a good night's sleep, like a few decent meals, a chance to speak to a loved one, particularly if you're worried about them, and a chance maybe even just to have a shower or something as simple as that can make a really big difference. Now, those PIES principles have been used time and time again in military forces around the world, and also applied very much to other organisations that predictably put people in harm's way. And the good news is, from the evidence point of view, and as a professor, I like a bit of evidence, is that there are studies that show that the more these principles put in place, the better the outcome is 20 years later on. So it might seem like common sense and a good idea, which it is, but actually if you put those common sense principles into practice, then actually you're going to have a really good impact on both staff well-being and also on people's ability to carry on performing their role. That's me. Thank you very much.
Thank you ever so much, Neil, for sharing these principles with us. I'm now going to hand over to Helen, and we're going to pick up some of the questions in the chat box during the session as well. So if you have questions for Neil, Sonia, Michael or Helen, then please do add them into the chat box. And now I'm going to hand over to Helen.
Thank you, Zoe. And again, I'd just like to welcome everybody to this session. There are so many of us taking part. There are over 500 of us on the WebEx, plus another big gang of people on YouTube as well. So really would like to welcome everybody. And when we were designing this session now, we wanted it to feel like a conversation. So we've got Neil and Sonia who have rejoined us, and also I'd like to welcome Professor Michael West. I'm getting quite a lot of background noise, so what I'm going to suggest is our conversation panel. Can you actually mute yourself unless you're speaking? So that's great. So I'm going to start. I'm going to start with Michael, just to say I've got a few questions to start with. As Zoe said, we'd like you to put your questions in the chat box. And this is where I'm going to rely on our 3 chat box monitors. So Karen, Louise and Rosanna, in that order, I would like you to pick out some questions to ask our panel. So I'm going to start with Michael. So Michael, fantastic to have you as part of this work. And I think that your perspective on compassionate leadership, I think, is very valuable, and I think will make such an impact over the next period. And Michael, what I wanted to ask you is that every time I'm in a conversation with you, and you remind us around slowing down and having time to reflect, even in situations of crisis. So what I'd like to ask you to do first, Michael, is to say some things that will get us into the spirit of this conversation. So, how do we need to be now?
I think compassion, Helen, is the core value for us. So people are incredibly busy, they're incredibly concerned, incredibly frightened. Compassion is the most important intervention we know of in healthcare. Compassion is how we humans connect with each other. And connection is more important now than anything. It's the most important need we have after our basic biological needs. So connection now is hugely important. Feeling that we belong, feeling we're cared for, especially in a time of great fear, great uncertainty, is absolutely fundamental. So now more than ever, we need to be compassionate. And that means 4 things. We need to learn to be present with each other, to listen to each other with fascination. With all of this going on around us, just practicing being present and deeply listening to each other. Second is we have to understand each other's challenges, the difficulties, the fears, the concerns, not by imposing an understanding, but by deeply being present with each other. We have to third, empathize. We have to care for each other. We have to understand each other's feelings at this very difficult time. And we have to have the intention to help each other. And just practicing those 4 behaviors not only helps the other, but it helps us. We know this, that it helps people themselves to cope with these difficulties.
Thank you. And I think let's carry on, practicing and role modeling that way of thinking and that way of leading. I've got a question for Sonia and one for Neil, and then and after that, I'm going to then hand over to our chat box monitors to pick up the questions from our participants. Okay. So my question for Sonia is, I think your life has changed profoundly in the last 3 weeks in terms of the work that you've been doing. How, given what Michael is just saying around, being present, connecting, tell us how it's felt to be part of this work, Sonia, for the last few weeks.
I think it's an immense privilege to have been invited to lead on the work. So there's that sort of responsibility. I think the pace of delivery, the number of people who want to be updated and involved has meant that at times it's chaotic. It's hard work, it's meaningful work, but it's hard. And I recognise the piece about, I've been saying to a lot of my colleagues in NHS England and Improvement that because we see our colleagues on the front line who are absolutely delivering all they can, it can lead to us overworking because we want to make a difference too. We want to be right there alongside you guys. So I think that level of being able to switch off, especially because we're all at home, so it's much easier to kind of be going beyond what is a normal working day anymore. I think one of the values for me that Michael absolutely helps us with is just to stop and recognise and think and connect. And I'm really privileged that I reside in a team who reach out to me. I don't think I'm very good at doing that for myself right now. So they're constantly in touch and talking to me about how I am and what do I need, which I really value.
Right. Thank you, Sonia. And my question to Neil is, you talked about resilience being a team sport. So I'd like you to say a little bit more around, how can we be resilient as teams and what do teams need to do?
So in an ideal situation, you want a team to kind of know each other and to feel that they've got each other's back even before the crisis hits. Of course, the challenge is that that might have been your intention, but then the crisis is here and then it seems to be a bit too late. So actually the key elements of resilience within teams are feeling that you are able to go and speak to another staff member who's someone who knows. You're able to share stuff with them. And importantly, actually, it's a reciprocal thing that they come to you and you come to them. Another important aspect is about sharing of information. So at times we get bits of information that are really critical to either do your job properly or might be related to your own personal safety. Actually, we need to share those really proactively with each other in order to feel part of that team and protected. An important aspect for a supervisor's position is about the desire sometimes for a supervisor to say, yeah, my team can do that, we can keep going, even when actually it probably isn't the best thing for the team. So the supervisors need to do that difficult balance of saying, yes, we can deliver, but at the same time making sure they don't over-deliver, which doesn't protect their team's own health and their own psychological resilience. And I guess the other last key element of it is about looking out for each other. So the advantage of working in a team where you know people is as you begin to change, so you become more shouty or you become more introverted or you appear to be less on the ball and doing your job than normal, that actually people around you can spot that. And that goes back to that psychologically savvy conversation and not accepting that how you doing, I'm fine being the truth.
But I'm going to break my own rules because there's one other I wanted to ask you.
Getting a little bit of feedback from your computer. It was fine before, but thank you. If you don't mind just muting between, that's super. But we want to hear all your views. So, sorry, back to you, Michael.
So the team is enormously important, as Neil said, in terms of being a source of resilience. And I think one of the most important things that teams need to do during this time is make sure that they're taking time on a regular basis to have time out together. Whether it's 10 minutes at the beginning of a shift, 15 minutes at the end of the shift, or once a week coming together to review, it's absolutely critical, not only to their well-being, but also to their productivity and effectiveness. And that's an opportunity also for all voices in the team to be heard, to reflect on how they're functioning. In the context of a crisis, Helen, in relation to your question, we know that from much previous research that in a crisis like this, there is a tendency for leaders to react by adopting a sort of threat rigidity style. And we do need clear structures and processes. But at this time, more than ever, it's vital that people within teams and within our organizations feel that their voices are being heard, that they're able to have influence in this situation. Because in a high demand situation, we need to give people a clear sense and clear control. They need to have a sense of autonomy and control, because high demand and low control is the toxic cocktail for stress. So we also need to recognize that we have the most motivated, skilled workforce anywhere in almost anywhere in industry. And at a time like this, when there are so many uncertainties, we need to be hearing their voices to give us the guidance in this critical situation.
Thank you so much, Michael, and Neil. I should let you speak as well before I just get a question from Karen. Anything to add to that?
No, I would just add exactly what Michael said. I think the important things is, although we would like teams to be able to go out and go to the pub together or to the park and play sport, that's not where we are now. 10 minutes beforehand, 10 minutes afterwards, and actually just someone saying, how are you, but meaning it, I think can make an awful lot of difference at this time.
Fantastic. Thank you so much. So, Karen, would you like to ask a question and tell us who asked the question? And Sonia, I'll get you to go first.
Hey, so, thanks, Helen. Yeah, there's been lots of good sharing of practice and lots of questions in the chat box. So thanks to everyone. We've had quite a few questions, so from Vinny and Susie, about will the resources be available more widely than healthcare staff? So they will be available for social care staff. How about family members, and some from Fatima from community pharmacists?
So maybe that is a very good question for Sonia. So Sonia, tell us about how the resources, aspects of the offer are going to be made available more widely than just people in the NHS.
Yeah, sure. So we've had to step the access up from a standing start. So I'm sure you'll appreciate we've been doing this over the last 3 weeks. We've started off today releasing them for all NHS staff in England. That includes community pharmacists. We're absolutely clear of that today. We're having conversations with our colleagues, as I've said, in Ireland, Wales and Scotland. So we know that there is stuff coming down the line. Just hang and wait for that. And we've got discussions that in the next 7 to 10 days, what we're hoping is that Department of Health and Social Care are also working with us to put resources in so that the whole offer is accessible to our social care colleagues as well. The chat service, the 24/7 chat service, is absolutely available today for social care colleagues. And it is just a case of we want to make sure that we've got enough volunteers in place, that those volunteers have been through the training, so that when social care colleagues call, they are getting the best service as well.
Yeah, thank you very much. So the next person to ask the question is Louise. So Louise, can you pick a question for our panel?
Yes, thank you. Yes, there's lots of great conversations going on in the chat box and replies to some questions also popping up. So thank you everybody for engaging in that. In particular, at the moment, there was a question that came from Abigail, stating that given that variable levels of PPE and testing are having a bigger impact on colleagues' psychological well-being currently, are there any thoughts on how we can best support them in that situation from a psychological point of view?
Okay, so Neil, would you like to start with that one? Did you hear the question? Okay.
Yes, thanks very much. So clearly, if you're looking around a sort of Maslow's hierarchy of needs in the current situation, the best way to psychologically protect staff is to give them the right equipment and to give them the right number of staff to do the job. That's obviously ideal. I guess no one asked for COVID-19, and it's hard to prepare for every single eventuality that might happen. And whilst I'm not a government spokesman by any means, it strikes me by listening and by working around at different hospitals that there's an awful lot of effort going on to get the right things to the right places as quickly as possible. And so in many senses, whilst it's easy to feel, they let me down or this isn't happening, I think the situation is one where actually things are not going to be perfect. And as long as people work as hard as they can to make that right, hopefully psychologically, we know that people are looking out for us. Underneath that, once you've got the right equipment, the next best psychological thing that we need is a decent roster and decent sleep. And again, the situation at the moment says it's a bit of a crisis and we have to keep going and get that balance right. We can't give people every single amount of time they want off and just say, don't come to work if you're feeling that it might be a little challenging. We need all hands to the pump. So I think whilst the crisis is ongoing, yes, those points about sleep and rest and rotas and equipment are really important. But actually behind that, knowing that actually people are doing the best that they can for you, I think is psychologically protective. And hopefully staff in this incredibly difficult situation will appreciate that.
Yeah. Michael, would you like to add anything to that?
I think it's really important as well that leaders are honest with those they lead in this situation. People are afraid about PPE. And I think as long as they understand that everybody is working in the background, as Neil has said, but also that they're being dealt with honestly and openly, that builds trust.
Great. And Sonia, any reflections?
Just the level of fear, the level of fear that is out there right now from people who are both working with patients in COVID wards and surrounding wards. I absolutely agree. The best thing we can do is to get the equipment to people as and when they need it, but also have open and honest, transparent conversations about what we can do, how can we protect ourselves, help people feel that the risks that they're taking are warranted risks, and that's okay.
Thank you. Let's take a question now via Rosanna. So, Rosanna, have you picked a question for our panel?
Yes, I've picked a question from Byron. Byron asks about whether the panel can recommend any wellbeing measures that we can be using with frontline staff.
So, Neil, what measures should we be using?
So actually, one of the interesting aspects for me as an academic is clearly we're in the middle of a pandemic of COVID-19. We're also beginning to get towards an exponential growth in the number of surveys that are coming out to try and find out what's going on. Now, good science is absolutely essential, but I think it's really important to think about trying to get coherent, good quality studies going, and not to flood staff who are otherwise busy delivering frontline care with too many surveys. So with that in mind, a limited number of good quality studies, I think, is really important. But with that in mind, I think if you're going to look at the impact of this, you need to look at a few domains. One is about sleep and shift patterns. Another one's about mental health. So measures like the GHQ-12 are quite useful. There's no perfect measure. We could spend a long time arguing this one's better than that one and that one's not good. But the GHQ-12 is good because many other national studies have used that, so it allows comparisons. And another good, useful one as well is the Warwick-Edinburgh Mental Wellbeing Scale. Again, that's good because it looks at more than just mental health. And then the last thing I would suggest in terms of scales, if you're going to do a study, is to look at something that looks at moral injury. And there's quite a few moral injury scales out there, which I think one's called the EMIS. The EMIS is a good scale, because I think the challenges that staff face at the moment, as well as being frankly mental health and traumatic, are also very much down to the moral decision making that we're having to undergo at the moment. So hopefully that's useful.
Yeah, thank you, Neil. Michael, would you add to that? What metrics should we be using?
Yeah, just to add in, the other one to consider is the short form of the Health and Safety Executive Measure of Stress, which is widely used across organisations in the UK.
And Sonia, I know you've been thinking about measurement. Anything you'd add?
Oh yeah, I'd just say, God, don't. Please don't put any measures in at the moment. One of the things we're getting is overwhelmed by amazing offers of help and support from industry. And we've got a whole team working through some of the app-based measures for simple indications of well-being. I'd just take you back to what Neil said. The active watching and monitoring of our staff, who needs what, is the best type of measurement you can do right now. And then beyond our active phase, where we're looking at recovery, let's think more then intelligently about how we might measure who needs help and in what form.
Thank you. So we've just got a couple of minutes left, and we did advertise this as being in conversation. So the last thing I would ask you all to do is, having heard what each other said, is there a point that you'd like to build on that one of your fellow panelists said? Something that appealed to you or that you felt a connection with. So where should we start? I think we'll start with Neil. Would you like to build on anything that Michael or Sonia said?
Thank you. I think one of the things that I'd like to build on from Sonia's great description of this outline offer that's available is to recognise that actually things need to be built over time. And that at the moment, quite rightly, everyone is thinking about how do we prepare people and how do we sustain in the active phase. But the planning, I think, for going ahead to the recover phase is really important, because we're not going to get back to a new normal. I don't think any of us know what the next normal will look like, but we absolutely now can put in place, I think, a lot of things which will make getting back to the new normal better and easier. And I think we shouldn't just be aiming for not being ill. I mean, Sonia put it in her slides. I think we should be aiming for growth. And actually, if we can come out of this stronger and more resilient, that'll be a good thing. So my point would be, I think the work we've done so far is really important, but we need to keep in mind what's it going to look like 6 months afterwards, which I appreciate we're all very busy and there isn't necessarily time, but that's something worth giving some consideration to.
Thank you, Neil. And Sonia?
Yeah, I've been reflecting actually on how this situation can evoke a sense of helplessness in us. And as leaders of this workforce, we instantly want to jump in and help. What we absolutely know is that psychological intervention is contraindicated. It can be more harmful than good. And that actually 70%, I think we were talking about, Neil, of people will be absolutely okay given the right level of support. So let's not feel we need to rush in. Let's make sure that we kind of put our arms around people and make sure that they're supported in their usual teams, and they will be okay. But let's make sure that we've got those offers ready and waiting for people who need that further support.
Thank you. And Michael, you get the last word in this conversation.
Well, that's a real privilege, Helen. Thank you. I think it's really important in this most difficult time we've all faced is that compassion is at the core. And compassion is about our connection with each other and that sense of belonging. It's important that all of us, it's not just advocating for those out there on the front line, all of us try to spend quality time with the people we love and who love us. That in our work, in our teams, that we are kind to each other, we support each other, we do the little things that make a difference, like giving someone a cup of tea. It's important that we connect with ourselves as well through just having quiet time, practicing mindfulness, meditation. If we can, spending a little time just looking at nature around us whenever possible, and connecting with our wider environment. Self-compassion in all of this is key because it creates that sense of safety, that sense of stillness, that safe refuge, which will help us collectively come through this together and at the other side to be a better society and a better health and care service for it.
I think that's a beautiful place to end. And I was going to summarise, but I'm not, because I just think, just in terms of what all three of you have said there, I think are so profound and so right. And I certainly look forward to working with all of you over the next period. And thank you so much for that conversation. And Zoe, back to you.
Thanks, Helen. Thank you, Sonia. Thank you, Neil. And thank you, Michael. I'm going to invite our speakers to go into the chat and answer some of the questions in the chat as well that are coming through. There's so many messages of thanks, both on the YouTube Live and on the WebEx. And there's so many questions coming in as well. So thank you so much. I'm just going to end this time together with a reminder about the wellbeing support offers that are available. So we've got the telephone number, we've got the text support with a real person on the other side of that text. We've got the wellbeing apps, and I've used some of those myself as well. And we've got the website. Now on the website, there's lots of links to lots and lots of stuff that is being developed at the moment. I've seen so many questions about what is the support for people who lose a colleague, and I'm going to ask Sonia to touch on that in a moment when we have some final words. So these are the wellbeing support offers that are available at the moment, and there'll be more and more coming throughout the days, weeks and months, so that we can support ourselves and we can support our staff and colleagues. What I'd also like to highlight is that we're going to be tracking some experiences. Your experience as someone who is supporting the health and well-being of our NHS people. And we're going to be using a platform and a system called SenseMaker, where you tell your story, and it could be just a few lines, and you complete triads like this one on the screen. So we just tell you tell us a little bit about your experience, and we can track these stories over time to see if we are providing the right input and support and how we can help each other. So if you're interested in this, please do email Rosanna Hunt. Rosanna's just added her contact details to the chat box on the webinar, and it's on the slide. And you can also, hopefully by tomorrow, find a link on our website as well, where you can spend maybe just 10 minutes sharing your experiences so that we can track them and provide better support. I'm now going to move on to one poll, and I'd just be very interested to know to what extent has today's session been useful in your own role supporting the health and well-being of your staff during COVID-19. So you'll find these a poll just popping up on your screen. And I'm going to ask Paul just to open the poll for us. And you should see it on your screen now. So there's just a few more moments on that. And when you have completed it, please do add some comments to the chat box. We're going to be running these webinars every week, every Wednesday, 4 till 5. So if there's something else that you would like to see, then please do add it to the chat box. Next week, we're going to be having more of a community feel. So next week, we're going to be learning from each other, sharing our experiences. We're going to be using a different platform where we can go out into breakout groups and share our experiences with others and help each other. And we'll also be having some speakers as well. And then the week after, we'll have a similar format to today. So we've got the poll is through. The majority of people are saying that it's very helpful. So I'm glad it's been helpful, but please do add in the chat box what was the most important thing for you, what was helpful, and also those very important, even better ifs. What would you like? What help and support do you need from us? So I'm just going to move on to our final chat box exercise before we come back to Sonia for the last few moments. So what I'm really keen to know a little bit more about are, where are the gaps? What do you need from your local, regional or national team? What do you need to help you? What do you need from others to help you and your colleagues? So I'll just give you a few moments to add that to the chat box. And while those are all coming in, I'll just pull a few of those out. And actually, I might come to Lee now. So Lee's been on our social media. She's been on Twitter. And Lee, what's the traffic been like? We had lots of input on Twitter at all during this session.
Hi Zoe, yes, we've had an amazing amount of tweets. People have really been enjoying what our speakers have had to say, and they've been including quotes from the speakers that they're going to take away to their teams, and they've been saying that they're going to be adding the experience and expertise from today to their own organisation's wellbeing strategy. So thank you very much to everyone.
Thanks, Lee. So please do keep all of these ideas and letting us know where are the gaps into the chat box. There's lots coming through, and we'll pick these up for our next session as well. So this is our flyer for the next session. So as I mentioned, it will be an interactive session. It'll be on Wednesday, the 15th of April, same time, but we'll be on a slightly different platform, which is Zoom. And we'll put that on the website, and we'll put that in the chat box shortly as well. So that's the next session next Wednesday. So Sonia, can I come back to yourself to give us some final closing words? And also, could you mention about the great work that's been done on death of a colleague and the support that's going to be provided?
Yeah, of course. Thank you, Zoe. So Hospice UK, as I mentioned earlier, have engaged with us in order to deliver some specific support packages. Again, going through that single front door, through the helpline, and then onwards to Hospice UK. The other thing that we wanted to do is to support you in building up some national guidelines around what you could do in order to support staff who are going through the loss of a colleague particularly. And again, building on some local work that we already know has been brilliant and is already happening. In terms of final words, I really want to express my thanks to the Horizons team. So all of the task force members are really clear that this isn't about us having the knowledge amongst a few of us. We were really keen that the information that we have access to is spread as far and wide, and that we're making it as useful as possible. We very much see these sessions as echoes from the system, a two-way conversation. And just to re-emphasise the idea that this is today's offer, this is iterative. We want to be helpful, we want to be useful. So really would encourage you to get in touch if you think there are gaps, if you think there's other work we could be doing. We really want to support you.
Thank you, Sonia. So we hope to see you next week. Thank you ever so much for joining us, and take care. And please do share with your colleagues all of the support offers that are available, and keep your eye out on that website for more and more things coming and developing. So thank you so much for joining us, and take care.